Hi everyone, today I am giving you explanation on the topic dacryocystitis. This is the dacryocystitis part 2 in which I will cover the treatment of congenital dacryocystitis. Okay. Treatments. The following treatment varies from the age to age of a child. As the child grows in age, then these treatments vary which treatment we have to give to the patient. First treatment is massage over the lacrimal sac area and topical antibiotics. Second one is lacrimal stringing with normal saline and antibiotic solution. Third one is probing of NLD with Bowman's probe. Fourth one is intabulation with the silicone tube. Let's discuss them one by one. First of all, massage over the lacrimal sac area and topical antibiotics. This one is the first treatment in which we will do massage over the lacrimal sac area. This one is the lacrimal sac area and we have to do massage over that area. We have to put our finger and then we have to move it from left to right and then from right to left. In this way we have to massage on the lacrimal sac area. Okay. And topical antibiotics. Some antibiotics are prescribed by the doctor which we have to instill in the patient eye as according to the dose give by the doctor. Okay, this is the treatment of NLD block. Now this treatment is done when our nasolacrimal duct gets blocked. It is done up to 3 to 4 weeks of age. Now at this age group this treatment is done for the child. Massage increases the hydrostatic pressure and helps to open up the blockage. When we do the massage over the lacrimal sac area, then the hydrostatic pressure gets increased. Due to increase in hydrostatic pressure, the blockage gets open up automatically. Massage is done 3 to 4 times a day. Now we will do the massage for 3 to 4 times a day. Installation of drops is must. Okay. Overall, we have to do this treatment 3 to 4 weeks of the age of a patient. Massage is done 3 to 4 times a day only and have to instill the drops. This was the first treatment. Let's jump to the second treatment, which is the lacrimal stringing with normal saline and antibiotic solution. Now lacrimal stringing is done, okay, with the normal saline. Here the lacrimal stringing is performed. Now we have to fill the syringe with the normal saline and have to pass the needle of the syringe from the lower punctum and then canaliculi. Then the saline passes through the lacrimal sac and the NLD and some other parts. Okay. This treatment is done when the congenital dacryocystitis is not cured up to 2 months. If the congenital dacryocystitis is not cured for 2 months, then this treatment is performed. Lacrimal stringing may be carried once a week or 2 in a week. This stringing is done sometimes once a week and sometimes 2 times in a week. It should be continued with the massage and antibiotic treatment. We should regularly massage 3 to 4 times a day on the patient lacrimal sac, as well as we have to give the drops to the patient, instill the drops to the patient's eye which are prescribed to us. Okay. This test is performed by giving the patient anesthesia dose, or sometimes any drops are instilled in the patient eye so that the patient do not feel any kind of pain. Okay. Next is probing of NLD with Bowman's probe. Now this treatment is performed when the congenital dacryocystitis is not cured for 3 to 4 months, then this is performed. In most instances, a single probing will retrieve the obstruction. In most of the cases, when we do only a single probing, then the obstruction will get clear. In case of failure, it is repeated for 3 to 4 weeks. But if it gets failed, then it is repeated for the 3 to 4 weeks. Let us see this test with the help of a diagram. Okay. This one is the Bowman's probe and it is introduced in the patient eye from the punctum and then it follows the canaliculi, then moves to the lacrimal sac. Okay. Imagine that there is a obstruction. Okay. When this probe passes through the lacrimal sac area, then it will clears out that obstruction easily. Okay. So in case of single probing, by doing the single probing it will retrieve the obstruction, but in case of failure it gets repeated. Okay. This was the whole procedure of this test. Let's jump to the fifth test, intabulation with the silicone tube. Now the silicone tube should be kept in the nasolacrimal duct for about 6 months. Okay. This one is a silicone tube, and it is passes through the patient punctum, followed by the canaliculi and then lacrimal sac and NLD. It comes out. This tube is kept in the patient NLD for about 6 months, and the drainage of the tears takes place through this silicone tube. Okay. Now, I have completed the 4 tests, which are the non-surgical treatments for the congenital dacryocystitis. Other treatments are depends upon the surgery. For example, dacryocystohysterotomy and dacryocystomy. Okay. So, I have completed only the surgical treatments of it. Thanks for your patience listening.